Each year, thousands of Oklahomans are diagnosed with a disease which can cause blindness, loss of limbs, and even death. Diabetes has reached epidemic proportions in Oklahoma and across the nation. Efforts are underway to raise awareness about the issue, and lawmakers are proposing legislation next year to promote treatment and prevention of this potentially deadly disease.
Diabetes is a group of diseases that affects how the body processes sugar, or glucose, in the bloodstream, and the numbers in Oklahoma are skyrocketing.
488,000 persons in Oklahoma has diabetes, and 100,000 persons in Oklahoma have diabetes and don't know it. And then if you look at persons in Oklahoma with prediabetes, 1 million people, or over 1/3 of the state's population, have prediabetes and they don't know it.
Tara Conway is a certified diabetes educator for the Cheyenne Arapaho tribe. She was at the state capitol this week as part of World Diabetes Day, an event aimed at drawing attention to the diabetes epidemic. According to the state health department, Oklahoma ranked 9th in the nation in 2012 for the percentage of adults diagnosed with diabetes, a percentage which has been growing at a faster rate in Oklahoma than in the U.S. as a whole. While often labeled as a silent disease because symptoms go unnoticed in its early stages, diabetes can have serious complications, ranging from kidney failure, loss of vision, and heart disease. For patients diagnosed with diabetes, out-of-pocket expenses can total hundreds or even thousands of dollars a month.
Because you have to pay for medication every month, you have to pay for physician's visits. If you have complications, you may have to pay for that. Eye screenings every year, test strips, those things. So it's just costs more when you have diabetes.
During the 2015 legislative session, lawmakers passed Senate Bill 250, which directs the Oklahoma Health Care Authority and the State Department of Health to develop goals to reduce diabetes, improve health care services for those with the disease, and better control complications. State Senator Roger Thompson is chair of the Senate Diabetes Caucus.
Are there some things that we can do that will require legislative action? Some of those may be, we need companies that will do more, and insurance companies that will pay for pre-diabetic treatments.
Senator Frank Simpson, the caucus vice chair, says one of their goals is to demonstrate to insurance companies that paying for prevention programs is cheaper than treating diabetes.
Right now, a citizen with type 2 diabetes costs the taxpayers about $20,000 a year. If we can provide a good counseling program, a good prevention program, that can be cut down to about $5,000 a year, which is the cost of the program.
Simpson is also considering legislation to broaden the use of telemedicine, especially for those who live in rural parts of the state.
For many of our seniors who are suffering with type 2, it's not easy for them to travel the 50 or 60 miles that we have to travel to go to the doctor. So we're looking at a plan whereby we can fund through Medicaid a telemedicine program to allow that information to be transmitted to the physician without the patient having to travel a far distance.
Both Thompson and Simpson understand the impact the disease can have on families. Thompson's son has type 1 diabetes, and his wife recently learned she's pre-diabetic. Simpson's granddaughter was diagnosed with type 1 diabetes at the age of 12.
She passed away. We lost her this year, June the 11th of this year, at the age of 29, from coronary problems related to her diabetes. And my goal through this, getting involved in the caucus, is maybe to help prevent some other families from going through that pain and suffering.
One question is whether the election of Donald Trump will affect insurance coverage for diabetes. President-elect Trump has vowed to repeal and replace the Affordable Care Act, which requires insurance plans to offer management of chronic diseases like diabetes. But Thompson doesn't expect an immediate repeal of Obamacare.
I don't think that President-elect Trump is going to be able to step into office, sign a piece of paper, and say we're done. I think that would be catastrophic to the state of Oklahoma and to people across America.
And Thompson says he's heard assurances that some aspects of the Affordable Care Act, such as coverage for pre-existing conditions like diabetes, will likely remain in place even with Republican majorities in Congress and a new president in the White House.